Hi, this week I'm excited to say I have Dr. Carly Roman joining me again.
Hi.
And today we're going to be talking about hair loss. It's something that affects men, affects women of all different ages. And Dr. Roman is one of the Seattle gurus on hair loss, so we're going to let her answer the questions. So are you seeing much hair loss right now in the time of COVID?
Yes, I'm seeing a ton of hair loss. So I would say normally I see a lot of hair loss throughout the course of the year, but certainly in the last few months we have seen quite an uptick. There's a lot of different causes of hair loss, but right now what we are seeing is a lot of what's called telogen effluvium, or what we call like sort of stress hair loss. So this pandemic's been around for 8 months or so, and typically after about 3 months or 3 to 6 months after a big stressor is when people do notice a lot of shedding. And so we're kind of right in that window where people are noticing I'm shedding a ton, I take a shower, I'm seeing clumps of hair, my hairbrush, there's a ton of hair, it's all over the floor. And so that's one of the most common causes that we're seeing right now.
And sort of different than some of the other sort of historically, when somebody has a baby or goes through a divorce, there's like an event and then they lose their hair 6 months later. Mm-hmm. This is sort of chronic stress.
Right.
So how does that make it different?
So it is a little different in the fact that it seems like it's lasting a lot longer. So you're right. A lot of people postpartum, in that kind of 3 to 6 month period, it's like a light switch. They all of a sudden notice they're shedding, but then like a light switch, it stops. We are seeing that it is lasting a lot longer. It's more of a period of weeks, several weeks, even up to a few months where people do notice that they're shedding quite a bit.
And so, I'm always annoyed when people are like, oh, control your stress, right? We can't control our stress. That's
Right.
not something that's possible
No.
right now. So if we can't control our stress, what can you do if you're noticing a lot of hair shedding? Like, what are some steps you can take at home, and like, when should you go to the dermatologist?
Yes. So I think one of the things that I actually really like in this setting is just nutritional support. So there are a few supplements on the market. I do think that the one with the most evidence is something called Viviscale Pro. It's one supplement you would take twice a day.
Pro, that's important to
Exactly.
know that there's two different kinds. There's a pro, and then there's the kind that's available over the counter, not at a doctor's office.
Exactly. So the Viviscale Professional, we do have better evidence that it's more effective. The other common one that you'll see out there is Nutrafol, and that also has some evidence too. So just nutritional support, giving kind of the hair root everything that it needs to be able to stimulate and regrow good, strong hairs. It is, an okay time to think about things like Rogaine or minoxidil, which can help to regrow hair or lengthen that growth period. Problem with something like that is it is meant for more of the long term, so you do have to be proactive. If it's something that you feel that you feel really strongly about, you would start it now with the idea that you would continue it for the long term.
And when you say long term, I think people oftentimes worry about, okay, if I start Rogaine, I'm on it forever. Mm-hmm. And I say, yeah, that's kind of the case.
Yeah, that's the point, yeah.
But it also delays the thinning for as long as you use it. So
Exactly.
You sort of have to make that commitment.
Yes. So it is certainly like maintenance, but we brush our teeth twice a day. So adding something like that, depending on how much it bothers you, can make sense for you.
And when do you encourage people to start looking at these supplements or using Rogaine? Like, how early in the process should people get involved?
So I think that answer, it differs a little bit for everyone, and just depending on how much it bothers you. If you are someone that you realize or you look around at your other relatives, they're thinning, and if you were at that same point and that would bother you, the earlier that you start, the more effective all these treatment options are going to be. Things like male or female pattern thinning, what happens is that hair root is becoming essentially like lazier or falling asleep, and it's easier to sort of wake up that hair root, getting it to be effective, making kind of those thicker, darker hairs, the sooner we are on top of it. If it is asleep for years and years and years, it is hard to wake that up. So the earlier that you are, the more effective that all these treatments can be.
So that's a great point. And it's sort of like the way I approach scars is like the sooner you get at them, the bigger difference you can make. I do also think that once you start with this process, you're going to realize it's not as much work as you think it is.
Absolutely.
Right? So I think it's just like you said about brushing your teeth, is that an ounce of prevention versus a pound of cure. And I have a lot of male patients in their late 30s, early 40s who are just starting to notice sort of a loss of hair in the front. And if they start using one of these supplements or the Rogaine or the minoxidil, they do see sort of a really impressive regrowth, and it makes them really happy, and then that encourages them to continue. Something that I did want to ask you about is what are the pros and cons of doing an oral supplement versus using the topical Rogaine?
So I think, they work in different ways, and it depends on what you, I guess, feel more comfortable and can be more consistent with. I do think, Rogaine's been around for a lot longer. We have better data for Rogaine to support, how effective it is. So it's a really good starting point. The supplement's really sort of in its infancy. We have some data behind it. And then, the potential exposures, we just know less about the oral supplements. And so whatever you think you can be more consistent with, that will ultimately be the most effective option. But if you were going to start one place, I do think, the Rogaine's a better place to start.
So in addition to that, what I find in my patients is that if they're already hairy, if you're already growing facial hair that you don't want, if you're a woman, if you're growing, I find that the oral supplements increase your hair growth everywhere. So they're gonna make you have longer eyelashes, thicker eyebrows, but also more goat hairs on your chin. And so for some women, that's really unacceptable. And the topical Rogaine, it really is only going to make hair grow where you apply it. And so I feel like for those individuals who are really worried about hair someplace else, Rogaine's a great place to start.
Absolutely. And so that you bring up a good point. The supplements, people do like the additional eyebrow eyelash stimulation, but that's a double, the other side of that coin is that you could have hairs elsewhere that you don't like growing.
And then the last thing, which I think is really hot in the press right now, is PRP for hair loss. So talk a little bit about that and what you can actually expect from it.
Yes, so I actually do PRP in my practice. We love it. So it's more of a procedural based option. And so what we are doing is taking your own blood and then actually spinning it down to take those platelets, which make your growth factors, and actually injecting it into your scalp. What we anticipate is about a 20 to 30% increase in the thickness or the hair density on your scalp. It is done as a series of about 3 sessions, and then you see results about 3 months after your last session, so 6 months after starting. But I think it is one of the more impressive options we have out there, especially, just short of like a hair transplant.
And is it something where you're one and done? Like, what's the system?
Yes. So like everything with hair growth, it
With
requires
everything in derm,
totally.
it's all about the maintenance, people.
So it is certainly not a one and done. There is maintenance to it. It's typically about every 6 to 12 months following those initial 3. And really just, again, we want to hit those hair roots with that growth factor, getting them to wake up, getting them to make those thick, strong hairs so you maintain kind of the hair density on the top of your scalp.
Yep, exactly. So the point is there's a lot of things that can be done for hair loss, even during stressful times. And if you have more questions about it, just DM me or ask questions underneath this and we'll get back to you.
Yeah.
Thank you.